Aloha. Thank you for tuning in to episode number 40. My name is Christina Estrada, partner of Booyah Marketing, where we have deeper connections. Today, our returning honored guest is Suzanne Kellner-Zinck with 30 plus years of experience working in mental health, specializing in holistic healing through hypnosis, helping clients quickly address the root causes of emotional illness when traditional mental health approaches have failed. Public speaker, author, podcaster, a mover and a shaker, setting souls free to live their purpose on purpose. How are you, Suzanne?
Very well. Very lovely to be with you again, Christina, so we can have more fun.
Thank you.
I don't know,
Yes.
educating the public about things that they really do need to better understand.
Yes, yes. So we were talking last week and you brought up the fact that licensed medical providers, MDs, nurses, etc., are fearful of getting mental health services. Why is that so?
Because the system is very screwed up. Think about it this way. If, especially if you think about people who are working in the ER and they see trauma all the time,
Hmm.
or EMT drivers, these kinds of people, or even people who work in ICU, they see all kinds of really horrible trauma, their patients have gone through. And yet these folks are scared to get any mental health work done because should they be diagnosed with something called depression, they may find themselves losing their license to practice if the board, the professional board, finds out about this. So then we have to ask ourselves this very serious question. If we're not willing to help the people who help us get the help that they need, how are they going to help us? It's ridiculous. The whole
Hmm.
system is so screwed up, it makes no freaking sense. But this is a reality, and this is why they're fearful of getting any kind of mental health work done. And they don't know, like, we have all these electronic medical records, and this is to not have the polypharmacy that was always going on, which is a fancy word for saying taking too many meds and, different doctors prescribing different meds to the same patient and not really understanding how they might interact really badly with one another in some fashion or form. So the electronic medical records were there so that this would not happen. So all the doctors could see all the prescriptions that were being written by each of the other ones, so that wouldn't happen. Not that it doesn't happen. It does happen, especially with the elders who are on too many medications, but that's a different story for another day. So we have a real problem here. How do you trust the people to be able to take care of you if they're not even able to deal with their depression or their anxiety or whatever their problems are? They might be having personal problems at home. And I work with a lot of these folks, frankly, over the years, and they're human beings, they have their issues too. Amazingly, even more in the psychiatric psychological world because they get into this profession, as I did, because they want to find out more about what's going on in their lives, maybe in their family of origin and all these kinds of things, and they end up deciding that it's really fascinating. They want to help other people. The problem is that many of these people, too many of them, after 32 years of being in the business and working with them on both sides of the couch, I can say, most especially through the hypnosis, they have not let go of their own crap.
Hmm.
So you have a patient come in and talk to them about something like, let's say, for example, I give you a really great example because this actually happened. I had a client who came to me because she had blackout drunk episodes. Okay. And she caused a lot of chaos in the house. She blamed her husband for these problems, but it was her that was having these problems. But I wouldn't know this unless I had talked to both of them. And I also talked to all of her kids. And the two twins yelled in my face, "We cannot stand her. She's a bitch. She doesn't take any responsibility for anything, et cetera, et cetera." I mean, really, they were really, really angry. Rightfully so. She caused chaos. However, if she had gone to a regular psychologist, most likely they would have taken her word for it, blamed the husband for what she was saying was going on. I'm not saying that some things weren't going on that needed to stop, but not what she was talking about, and never having her take responsibility for her alcoholism.
Hmm.
Because, if
Hmm.
you're a therapist and you went through a divorce or you're having a bad marriage, poor you, I feel so bad for you. You're right, he's wrong. How do you know? Until you talk to both sides. You don't know anything. And what you're doing is you're making her a victim instead of having her heal and become the victor by doing the forgiveness work. That's the only healing that can happen. So we have multiple layers of problems as far as I am concerned. Thank you for the
Mm.
question. Next.
Yes. So what happens to them when they can't get the mental health services they need?
Well, what happens is they become crazy. Have you ever noticed them being on edge, or they have to be very controlling of things, or maybe they're not paying enough attention to you? I mean, that could just be the exhaustion because I have to see so many freaking people every day because of the medical industrial complex, you know?
Mm.
For the medical people, it's like 7 minutes max. But in terms of, your psychiatric people, well, they only get 15 minutes, psychopharmaceutical people, unless they're doing therapy also, which most of them are not anymore. Because again, the medical industrial complex doesn't make that much money if they do it that way. So then you're left for the psychologists, and these are the people, and the master's mental health providers are actually the worst as far as I'm concerned. They really do project a lot of their garbage onto their patients. And I get the notices a lot on CAR. I write a lot on CAR, which is basically a forum for people to ask any questions about anything. And some of us who are experts in our fields actually answer these questions with some depth and breadth and understanding so these people actually understand what it is that they need to be doing next, or teach them how to do some stuff. I have
Mhm.
no problem doing that. Give them the steps. How do you do timeline therapy? It's like 5 steps, no big deal. Teach them how to do it right there. So basically, timeline therapy is really good for getting rid of negative emotions, anger, sadness, fear, guilt. And I used shame actually for my addicts, as well as limiting beliefs. So there you go. But it's a problem because, in core, the patients will say, we can't find a decent therapist. Why are there no competent therapists out there? Why do they all suck? I mean, they really do use these words, and I get these questions all the time because I've been writing on them for a really long time. So I'm known as an expert on this stuff at this point now. So that's a really, really bad thing
Mhm.
to realize, that you can't even find a decent therapist. And then we have a problem with child and adolescent therapists. There aren't enough to take care of them actually at all. So, you have kids who are going through a really bad situation. They have nowhere to go because there's no openings. So that kind of sucks. That's a problem as well.
Mhm.
So that will tell you that these people are like totally, probably burnt out because there's not enough people, professionals to see the patients that need to be seen. And if you're feeling burnt out, you can get really irritated and you can get really depressed and really frustrated. And if you have bosses don't care, because most of these people, again, work for the medical industrial complex because they have bought these practices, because in many cases the malpractice insurance has gone so high. And if you have a medical office, the just to fill it with all of the machinery and stuff that you need is really, really expensive. Never mind the personnel, if you have nurses and assistants and these kind of people that you have to pay salaries to as well. So it becomes a very large problem as far as I'm concerned. And I kind of have found myself over the years, as I'm getting older and wiser, doing all this research, both for my master's programs and now my doctoral program, and most especially to help my clients. I realize how vacant of true medical care the system is. For chronic people, if people have chronic conditions, I'm talking about autoimmune problems. I'm talking about people who have cancer. I'm talking about people who have mental illness, although too many people are labeled mental illness that have nothing more than normal, everyday, shall we say, challenges on the emotional level. But in order for these people to get their reimbursement from their patient's health insurance company, they have to use the diagnosis number, and that's how they get it reimbursed. And that's why you have a lot of this crap in the first place, just to say. Because many patients never even know what their diagnosis is. I've had a few of those come in to see me too. You know, it's written in the
Oh.
records. It's how they get their reimbursement. They don't take the patient. I had a patient years ago. She was a character. And she was thrown out of literally 3 practices for mental health. A
Wow.
psychologist, a master's level, something or other therapist, and what was it? I think it was a nurse practitioner. And
Mm.
they all threw her out because of her behavior as a borderline personality disorder person. Now, I was raised by a mother with borderline personality disorder, pretty bad personality disorder, if I do say so. The labiality, meaning switching from being really happy to throwing shit at you and yelling and screaming and being hysterical was like that. You never knew when it was going to happen. But in any case, I knew that she had these problems because, when you're raised by one, you understand the symptomologies, and the thing that they're most scared of anything at all is abandonment. So you can imagine how she felt being thrown out of three practices, but she had her reasons. And you have to just laugh. The first one, if you think about the offices, they had like one of these magnetic boards, and you could see if they were in or out of the office or whatever. And she would move them all around so nobody knew anything. That was one thing she did. She had another one who ignored her concerns. So she used to basically stalk her from outside the office, yelling up to the office. And the funniest one of all, the biggest pain in the butt thing that she did was she took, smiley face stickers and she put them all over the headlights of the therapist's car. So she got thrown out of those. But I told her, the one thing I can promise you is that you're never going to be thrown out of this practice.
Mm.
Your behavior will definitely be put into place when it needs to be, but you're never going to be thrown out because I know that your number one issue is abandonment. And, these people just had no clue. They have all these fancy licensures and they don't even know how the hell to deal with you. It's quite
Mm.
crazy. So anyway, I found out for sure that she was a borderline because I had her actually get 5 years of records from the first shrink who threw her out of the practice. And she treated this woman like she was a freaking infant. She would go to the husband to tell her all these things that she needed to do and how she wasn't doing what she needed to do in session and trying to threaten her. This is what happened. This is a gorgeous story. So me being me, I read through every freaking paper. I told her that she had borderline personality disorder. I had her bring her husband, and that took forever to get him to do because he was just very busy. And the thing he told me was this: listen up, people. He said, anything my wife has done is more important than anything I've done for this family because she raised four fabulous, productive, healthy kids.
Oh.
How can you argue with that? So much for these fucking licensed practitioner people. What the hell do they know about anything? Nothing. That's what they know. And I stand by that. There's a couple. I mean, I was very lucky actually. Many, many years ago, I had a really good psychologist who was based out of Harvard University. She loved working with what was then known as manic depressives, which is now known as bipolar 2 in my case, because I never had any psychotic events because it threw me on so much goddamn lithium. I could barely function, but that's a different story unto itself. Well, they told me that's why they did it. They didn't want me to have a psychotic break after the fact. She was really, really wonderful. And then I had one psychiatrist who meant well, but he put me on an antidepressant because I looked really depressed, and that cycled me up into hypomania, below mania, people, no psychosis. And that's how they knew to jam all that lithium on me as a mood stabilizer to get me back to normalcy and at least not cycling up. This is a way a lot of people are found to have manic depression and bipolar, by the way. And then I had another one who wanted to treat me as if I had seasonal affective disorder, and my case manager, psychologist, got me out of that psychiatrist care like that. She was doing a research project for her fellowship, and it was inappropriate because that wasn't my problem. And then I had another one who wouldn't take me off the goddamn medications when I couldn't do anything. So I had to drag this is after 6 months of complaining to her, 6 full months. Okay. I brought my ex in. I told him exactly what to say. Oh, miraculously, she listens to him because, he knows more about what's going on in my body than she does. Go figure. The next month, I told her again, put it in his mouth. I need to be dropped another pill. And she did that. But then my final psychiatrist, she was the one I stayed with for 13 years. She dropped it way down again. And it was with her actually that we found out that kidney was slowing down. Kidneys were slowing down and stuff, and she took me right off it. And then Todd James helped me get rid of it forever. Thank you very much, Todd James. He's up in the heavens somewhere. He passed away a few years ago. So anyway, these are the problems. There's many, many problems. Just looking at my situation, in car, you have people complaining about why can't I get off my drugs? Why can't I do this? Why won't they help me do that? It's because they're very fearful of what might happen if they take you off the drugs. Both because your brain is altered and also because you can have withdrawal symptoms. It's really bad, especially the benzodiazepines and antipsychotics and the SSRIs, I think are the worst. Benzos and SSRIs. Yeah. So if you don't need to take that shit, don't take it. Just don't. Don't go on that crap. Seriously, it doesn't help anyway. It's only got about a 30% placebo effect. And Dr. Irving Kirsch did the research on placebos using SSRIs, and I don't know, he studied them for like 30 years. And then Dr. Walter Brown out of Brown University, ironically, replicated his studies and found the same thing. They're placebo people. And anti-anxieties, I had plenty of nurses come into my practice laughing over the fact that SSRIs are used for anxiety. They don't really help with anxiety unless it's placebo. I have a sister who believes in her. It's Xanax, but just like if you're happy with it, fine. I don't care, but it's it's really not healthy for your body at all. So there you go.
Well, yeah, thank you for all the information. That's a lot. And I'm looking forward to this workshop that's coming up. It's on Tuesday, November 11th, 2025, 9:30 a.m. to 11:30 a.m. Eastern. What are you going to cover in it?
This is really for CEOs and C-suite executives by and large. And the people who are in these positions have so much responsibility. And sometimes they have employees, like one of my CEOs that I worked with had 35,000 employees all over the world. And she had a couple that she had a really hard time with. So I taught her how to use neurolinguistic programming language patterns in order to better communicate. And voila, problem gone. So this is the thing that we can learn how to communicate a lot better so that we can really with neurolinguistic programming, we're bypassing the critical factor of the conscious mind, which we know is the prefrontal cortex, where all your reasoning, judgment, rationalization happens, which is why hypnosis is so amazing. NLP is a form of hypnosis, by the way, for anyone who doesn't know that. And basically, what we're able to do is by using certain NLP language patterns, bypass that so people will just do what you need them to do. It's a very good skill set as long as it's used, shall we say, with integrity. And certainly, that's the only people I teach how to do this. In fact, when I work with my clients, mostly they have to go through their clearing with me before I'm going to teach them how to do anything, especially the mental health people. Because,
Mm,
as I already told you, they are very screwed up. And the same thing for hypnotists and NLP practitioners. They need to be clear before they're working on other people's subconscious mind. Don't try to apply stuff to other people if you haven't cleared up your own shit.
hmm.
That's the way to do it. That's the way I did it, and that's the way I demand it be done because I'm not going to contribute to more inept, harmful mental health providers being out there because of my not being cognizant of what needs to happen before I train anybody in this very, very powerful work.
Right. Right. So how do people get in contact with you?
Um, well, for the training you're going to have in the description, you're going to have the link for that for our language workshop. It's going to be very good. And then to get in touch with me personally, email me. But this is the thing, folks. I get too many freaking emails, even though my website guy did a really good job and got rid of a whole bunch of the garbage that I was getting. But still, there's too many because when you're in business, that's what happens. So in the subject line, you go asterisk, asterisk, asterisk. And then you write down the subject of what it is that you're looking for. And then I will see it. And then in the what do you call it? In the body, you tell me what it is that you want more specifically, and then we can go from there. It's the best way.
Good. Okay. Okay. So mahalo nui loa, Suzanne Kellner-Zinck, for your time. Any parting words you'd like to say to the viewers?
Yes. Stop believing in the medical industrial complex unless you have an acute problem, broken bone, heart attack, something like that. They're very, very good with these kinds of things, any kinds of, shall we say, burns. And, we're talking about acute things. Can't get any better than America. But chronic care, they're going to make you more and more ill because they don't know how to help you. For example, type 2 diabetes. Why in the hell are they giving people with type 2 diabetes, who are basically by definition insulin resistant, more insulin when their cells aren't taking in the insulin that they're making organically within their own bodies? It's idiocy and it makes them sicker quicker. Just one example of the idiocy of chronic care. I can name many more, but you get the point.
Yes.
Be thoughtful, do your homework, go to a functional doctor. They work with the whole body systems, and they will find out the root cause of your problem if you need medical stuff. And some chiropractors are really good too about that stuff. Don't see regular MDs. They're slice, dice, medicate everything, pill for every ill. No, no good.
All right. Well, mahalo. I'll put Suzanne Kellner-Zinc's information below in the description box. Please click the subscribe, notification, and thumbs up. If you also would like to donate to the channel, we appreciate it. It helps us build our content. My name is Christina Estrada, partner of Booyah Marketing. A hui ho. Until we meet again.